All right. Good afternoon. My name is Brittany Quickwarner. I'm the president and CEO of the Eugene Area Chamber of Commerce, and I am here today with our Lane County Administrator, Steve Mokrohisky, and we're going to talk a lot about, the county's reaction response to COVID-19. They have taken the lead with the Emergency Operations Center work, and obviously Lane County Public Health has played a huge role in our region for the response to the coronavirus. And but we also know that, this crisis has and will kind of create ripple effects throughout the rest of the county and your operations as well. So I look forward to chatting about some of those things and kind of what you're thinking about for the future and how we plan to continue to address this and move into recovery mode as soon as we can as a community. You all are watching. Thank you for being logged on to the Eugene Chamber's Committed to Community webinar series. This is I believe our 18th webinar that we've hosted in the last couple of months. All of these are posted on our website afterwards, and we want to encourage you to ask questions. So if you're logged on to the Zoom webinar, feel free to type those in the chat box. If you're watching us on Facebook Live, welcome. Please feel free to put those in the comments, and we'll make sure that we're monitoring both of those so we can get your questions over to Steve. So with that, Steve, I'll let you introduce yourself and kind of kick it off just with how things are going at the county and what some of your focus has been, and then we'll kind of dive into some questions.
Yeah, thank you, Brittany, and good afternoon, everyone. My name is Steve Mokrohisky. As Brittany said, I'm the Lane County Administrator. Glad to be with you today in this new virtual environment that we seem to be communicating with everyone on, and so I'm looking forward to the opportunity to share some information with everyone about Lane County's public health emergency response in the community to COVID-19, our planned recovery efforts for the community moving forward. I'm happy to talk about our budget and other actions that our board has taken recently. I know that folks are really interested in recovery and reopening, and we are, and so that's the hot topic of the moment, and so I'm prepared to share plenty of information about that. So I'm happy. If you want to just ask me questions, Brittany, to kind of prompt where you'd like me to go, happy to take those.
Yeah, for sure. So why don't we start with, kind of back from the beginning. So if you can talk a little bit about, how the county originally sort of handled this, and, the first couple, weeks, I guess, when things were just getting ramped up. What does that look like for you? How did this whole thing start for Lane County?
Yeah, I'm glad you asked, and I'd encourage folks, if you have a chance, we kicked off our budget yesterday. So my proposed budget for next fiscal year starts July 1st of 2020, runs July 1st, 2020 to June 30th, 2021. We presented that to the budget committee last night. Budget committee is our 5 commissioners and then 5 residents from appointed residents that serve on the committee. And in the budget message in our budget document, that I presented, I walked through a sort of a timeline of our response, and I think it's from a local community perspective. There's been a lot of question about, well, who knew, nationally and statewide, who knew what when, and what are response efforts, and how quickly were we on this? And so I thought it was really important as part of our budget message to kind of walk through at the timeline. So let me do that with you briefly.
Yeah.
Folks may recall, it feels like another lifetime ago, but on January 21st of 2020 is when, as a country, we first became aware of the first positive case in Washington state of COVID-19, right. January 21st. On January 22nd, the day after, so one day after the first case of coronavirus was confirmed in the US, Lane County held its first coronavirus coordination meeting with the Oregon Health Authority. 5 days after that, on January 27th, Lane County conducted its first coronavirus partner coordination meeting with Peace Health and the University of Oregon. On February 6th, we activated what we call an incident command system structure. ICS is sort of this national model for how to organize response efforts in an emergency. So anytime we have a fire or a flood or an earthquake or a major disaster, we deploy this incident command system structure that's a national model for responding to emergencies. So we deployed that model on February 6th. We also, on February 6th, had our public health officials began meeting with neighborhood association groups about COVID-19. On March 2nd, we opened our Joint Information Center and held our first daily press briefings. We continue to have daily press briefings at 10:30 a.m. every day. March 3rd, we held our first daily healthcare provider and partner coordination call. March 10th, we opened our non-emergency call center for the public to contact with questions. That call center continues to be open today. On March 17th is when we had our first positive COVID case in Lane County. Okay. So a month and a half of preparation and response work was happening before we ever had a positive case in Lane County. On March 20th, we worked with the Chamber, Eugene Chamber, Springfield Chamber. Lane County put $200,000 forward in a loan program. We got the City of Eugene and City of Springfield to put $100,000 each. So we pooled together $400,000, made that available for small business loans, up to $30,000 for small businesses, 0% interest for the first year. That was exhausted the first day that it was released. And we really wanted that money to go out quickly. And we knew there was federal money coming for business support, right, but we wanted our local businesses to have some immediate support. On March 23rd, Lane County opened, and we still have open our personal protective equipment donation center at our Public Works warehouse on the Delta campus. That remains open, and we're still collecting personal protective equipment from the community and distributing that where needed. March 24th, we opened a respite shelter for unhoused individuals at the fairgrounds. It includes hygiene stations, mobile food service, sleeping areas, and medical services. March 30th, we opened a respite shelter in Springfield at the Memorial Center with the same services. On April 16th, we closed, Lane County purchased the former VA clinic at 100 River Avenue for use as a COVID-19 recovery site for at-risk populations. And then we do have plans to convert that into a shelter navigation center, and that'll play into our budget process in the budget we proposed for next year. So that gives you just roughly kind of through mid-April, kind of what our process was. To date, as of today, we have 56 positive cases, 35. So the majority of those 56 who tested positive in Lane County have recovered. Approximately 18 of those individuals are sick at home. We have no one in the hospital currently, we've had no one in the hospital for about a week or so, okay, which is really great. Yeah. And we've had 2 deaths in Lane County. So I paint that, to be truthful, I think our success in Lane County at flattening the curve and the fairly limited impacts on health and life are a combination of really quick and quality response efforts and a bit of luck. Yeah. So those things have sort of converged, and our community's done a great job of closing down and participating in this physical distancing and quarantining. And now we're all really anxious and motivated to get reopened in a safe, healthy, phased way and get our businesses open and get back to work.
That's great. Thank you, Steve. So I could go 100 different directions with all of that for questions, but I think I want to start, I think a lot of times when folks hear the data about the testing and the number of cases, about the number of cases and deaths, one of the first things that they ask is, well, did we ever and do we have adequate testing? I think that, like the national kind of news really put an emphasis on, yes, we have this many cases, but it's because we're not testing everyone. Where has Lane County been with our testing? Where do we have to get at? I know we'll get into this a little bit, but the governor released those kind of 3 gating criteria. I think she called them. One of them was adequate testing. What I've kind of felt like the communication gap is, where are we currently at and how do we get to where we're supposed to be for that testing? So can you talk a little bit more about testing in Lane County?
Yeah, so let me say there's been focus on these 3 gating criteria. Important to know there's actually 7 criteria, and Dr. Ludke, Pat Ludke, is our public health official in Lane County. He came up with these 7 criteria. They've now been adopted statewide. They include adequate PPE supply, adequate contact tracing, adequate hospital surge capacity and plans for a second wave, declining case numbers, laboratory testing, local laboratory testing, a blueprint and education for the public and businesses on the process of relaxation regulations, and then support from Oregon Health Authority. So those are the 7 kind of statewide adopted criteria. The 3 that you referred to that are in the governor's order that we have to verify, and I will say the one that Lane County had to verify is around PPE. So the Board of Commissioners yesterday, I'll just jump past your question, then I'll come back to it.
Yeah.
The board yesterday approved, but in the governor's guidance, it's important to note, is still draft guidance.
Yeah.
So I was on a call yesterday with the governor. We had our chair and vice chair, as well as commissioners from throughout the state on this call with the governor. The guidance is still draft, but what the governor has said is the first date for going into phase 1 of reopening is going to be May 15th. While her guidance is still a draft, the board took action yesterday to do what they need to do to be in the queue, which is verify that our PPE, our personal protective equipment supplies for first responders, is adequate. And they did that. So we're ready to go. And I'll also touch on a letter the board sent asking the governor for more local control.
Yeah.
Our board, and we really want more local flexibility because we know there are going to be some exceptions to certain things, and we're going to follow the governor's guidance, but we want to be able to work with our business community and be as flexible and reasonable as possible in opening things up. So we're asking the governor for additional local flexibility and control in reopening, and we'll see if we receive that. So on testing is an important piece of this. And our public health has identified numerical thresholds for each of these criteria. So for testing, we're saying that we would like 500 tests administered locally per day. Okay. Now, our highest day to date has been around 250. So this would be double what we've actually had. We have, as of today, there's been 4,600 negative tests that have been reported to us in Lane County. Now, there's likely been more tests that have happened, but we get these reports from the Oregon Health Authority. And this was confusion early on in COVID. People thought Lane County does we don't do the testing. We track the testing, we communicate the testing, we do contact tracing with anyone who tests positive. So we get those reports, but we don't actually administer the tests. Okay. The hospitals, the clinics are administering those tests, and then they go to either the Oregon Health Authority lab or to a private lab. And then the positives all get reported to the Oregon Health Authority, and we get that information. The negatives, most of the negatives get reported, but some of them do not.
Yeah.
So what we want is, and we believe there is, we do have work to do on testing. We want to see 500 tests per day administered locally.
Okay.
Between all the health providers, the hospitals and health clinics. We believe that there is capacity for 500 tests a day, that we are ready and available for 500 tests to be conducted. Again, this relies on OHA and the private labs to provide those tests to local clinics and hospitals to administer them, right? Yeah. So we believe we have that. Part of those 500 tests, Lane County is asking, our public health is asking for 100 tests be administered for public health purposes for our tracking and tracing. And those 100 tests will allow our public health to monitor the situation and keep our community safe. That's really where the concern has been, is that, we know there are more people that are positive in the community than the 56 who tested positive.
Right. Yeah.
What's really good is we have not seen a surge. And I think the highest number of people we ever had in the hospital was somewhere between 6 to 8 at one time. Okay. We've had 2 deaths. That's 2 more than we ever want to see. Yeah. But at least it's been limited. Yeah. In that regard. So we've done a good job so far. And we believe there is capacity for those tests. But that's what we're looking for is 500 per day.
So when you say 100 tests for public health purposes, do you mean 100 random tests? So you can do some kind of calculations of folks who are positive or negative, or what does that mean?
What we're looking for is the the expanding testing is key to enable our public health to operate under these relaxed restrictions, right? So what we want is more tests. That more testing means that we can test all of our contacts that are not. So really what we're interested in is identifying, here's what we've seen. We know that a number of the newer positive cases, we had 48 positive cases for a while. And then we got to 50, and then we sat at 50 for a while. And then you saw last weekend, we had 4 positives. And then Monday we had another one. So we went to 50 to 55 by Monday. I believe 4 or 5 of those new cases were all related to prior positive cases. Got it. Which that's what we want to see, right? You want to see that there's less community spread, and that if there are additional cases that they're happening among folks that are already within a community of people, at least when we're under quarantine. Now we're talking about opening things back up again. So as we open things back up, it's going to be really important that we're able to track, trace, and do that what's called contact tracing. That's what our public health folks do. And they're professionals at this. They do this when you have medical people that go over to Africa and there's an outbreak for Ebola, and then they come back, and then we have to do contact tracing for those people in our community for 30 days. And we have to talk to them every day and test their symptoms and see who they've contacted with. That's what contact tracing is. So the testing we're looking to do is really around connecting with those individuals who have tested positive, who are linked to any of those positive cases or signs or symptoms that could occur.
Yeah, that makes sense. So someone asked, how can we volunteer to help with contact tracing? Are you guys at a point where you feel like you need additional assistance, and would you get to that point maybe?
Yeah, and that's a good question. You can offer, we have an email you can send to, we have a particular email for businesses, if their business inquiries, and I'll give you that. But for questions like this, you can send them to corona-info@lanecountyOR.gov. And you can find all this information at lanecountyOR.gov. And on our homepage is a yellow banner at the top. It says COVID-19, and just click on that, and there's all the contact information. And we have emails and phone numbers there for folks to contact. We feel, so let me say, on all the governor's gating criteria, because this is what people are interested in. Yeah. Right? Are we going to qualify? And the short answer to that is we believe yes. So on these criteria, we believe we have capacity for testing. The board verified yesterday through our public health officials' guidance that we've set up clearinghouses for PPE donation, as I told, out at our Delta campus. We have worked with our healthcare providers, the hospitals in particular, to ration PPE and decrease burn rates. Because of the low case numbers, we've been able to reduce the burn rates. So we have steady and dependable supply of PPE from Oregon Emergency Management and from our existing supply. And we have close and rapid access to local supplies. So PPE we feel good about. Hospital capacity, as I mentioned, 0 cases, 0 hospitalizations right now. So that's been good. Yeah. And every day that goes by, we learn more and we gain more sort of capacity and ability to set things up. We have been able to keep beds free in the hospitals. We have secured mobile triage units. We've seen declining case numbers. That's another of the governor's criteria. We believe we hit our peak around mid-April. Okay. And since then, we've seen declining numbers. You've seen that if you track the cases. So that's good. And then contact tracing, adequate contact tracing means we have 15 contact tracers per 100,000 people. Okay. Lane County is prepared to meet that need with a combination of existing staff. We have 4 full-time contact tracers, 3 part-time contact tracers, as well as a large pool of community service workers and nurses to draw from. And then we have a really great strategic partnership with the University of Oregon and Oregon Health Authority to pull that. So we also feel that we have that capacity. I'd encourage folks, if you are interested or we do need folks with some of that public health skill to be able to assist. in that regard. There are new investigative guidelines that the state has developed to identify kind of circles of protection. So we're monitoring all of that. So we believe all those things are in place, which is why, the board took action on PPE yesterday. We are going to be ready to say on May 15th to say to the governor, we're ready to go. We want Lane County to move into phase 1. So let us open up.
So let's talk about that, because that's new information to me. I feel like this is one thing that if I've heard frustration from businesses, this is that it really feels like there's been a lot of miscommunication or misunderstanding around what the opening up strategy is. We've heard in one situation, we heard that it was going to be regionally, that the counties who had, 5 or less cases were going to be considered first to go into that phase 1. We've heard that the whole state goes in it at one time and everybody has to be ready. We've heard that counties can apply to be in it. So I'd love any information you have on that. I mean, one of the biggest requests that we had from the business community was to have enough warning before we open phase 1 for them to really prepare to do that, right? Some of our restaurants, they're going to need time to purchase their food, to get their staff rehired and all of those things. So it would be news to me if the May 15th was actually a date that we would be reopening.
That, and I'll just say, I share, we all locally share the frustration.
Of course, yeah.
Around this. And, I was on a call yesterday with the governor and county commissioners and other folks from around the state. And we expressed this, that, we still don't have the final guidance from the governor on this. And we've really been pushing. I mean, we were pushing to say, why May 15th? The sooner that we can get going, if we can demonstrate this. So let me try to answer some of those questions. So I'll share the frustration about timing and lack of kind of understanding that we're in that boat too. And we've been saying, give us the final criteria, give us the roadmap and kind of the rules of the game that we're playing by. And we promise you, as a local government, Lane County and our partners will work with our community to do this and we trust our businesses and we trust our residents to do, let the free market do what it does best. And consumers are going to opt in and opt out where they want to. And businesses are going to know that they need to do things in a certain way in order to get their customers to participate in that. So trust us with that. So this is what I heard from the governor yesterday is May 15th. And there were people pushing to say, we need before May 15th. She said, May 15th is the earliest. You can go into phase 1. So if you follow this, and again, understand this has been draft guidance. So this is based on the draft guidance from the state. 3 phases. Phase 1, the earliest you can go into phase 1 is May 15th. What we're trying to do in Lane County is make sure we're ready, right? So we want the governor to say on May 5th, yes, Lane County submitted, they meet all the criteria, you can open. And then we can say, okay, we all can go into phase 1. That's what we're trying to get set up to do. In phase 1, for the public, it means continue good hygiene practices, encourage wearing of face coverings, homemade face masks when in public and around other people. It's a weird thing to do. I don't like it. I don't like wearing a face mask, but when I wear a face mask, I keep you safe, Brittany. Right. And when you wear a face mask, you keep me safe. So it's actually an unselfish act. Yeah. And it's a community thing everyone needs to participate in. So encouraging face coverings, stay at home if you're sick. And then employer policies. It's going to require that businesses come up with policies for distancing. How are you going to keep people physically distanced of 6 feet? Adequate personal protective equipment that you need, temperature checks, sanitation, monitoring of employees, those types. So every business has to come up with their own plan. Mm-hmm. And then there's, no more, it's restricted to gatherings of 10 people or less for social gatherings. And then there's certain things around restaurants and different types of operations. So that's phase 1. So then phase 1 is a 14-day period. We're in phase, so it's still it's like dipping our toe in the water in phase 1. It's not a mass opening. It's kind of like we're trickling, so I think we need to think about, businesses should be thinking about, it's not going to be it's going to be sort of an incremental process. We're then in phase 1 for 14 days. And 14 days is because that's the life cycle of the disease. So then we track, at the end of that 14 days. So let's say we go into phase 1, May 15th, after 14 days, what is that, May 29th?
Mm-hmm.
We look at our numbers as a community, and we look at how's our testing, how's our PPE, how's our hospital capacity, how's our declining case numbers. Have we seen a surge in case numbers, or are we still declining? How's our contact rate? We review all that. And after that, by May 29th, if this all works out this way, we look at those numbers and we say, we're the same as we were on May 15th or better. Then we can go into phase 2, right? So phase 2 means now you can have social gatherings up to 50 people, and it's relaxing things a little bit more.
Mm-hmm.
And then you do that for another 14 days. You review the numbers. We as a community, the county and everyone, we say, are we the same or better? Then we can go into phase 3. And phase 3, so think about that. May 15th, best case scenario. May 29th, best case scenario for phase 2. And then what is that, mid-June?
Mm-hmm.
Best case scenario, mid-June, is this broader opening, right? Which would be larger gatherings to a degree, up to a certain point. And some of these other restrictions continue to loosen. So, and that's what we'll do. We'll do that, and we'll continue to monitor and do contact tracing. And if we see a surge of positive cases and things don't start not looking bad, then we're going to have to start pulling back and ramping down. Okay. Does that make sense?
Yeah, it does. Yeah, I think it's May 15th is coming up quickly. So I think that as much notice and finalization on that as possible, I think is like I said, that's the biggest concern I've heard from restaurants is they were hoping for at least 2 weeks notice. At this point, they might get 1 week at best. And just
here's
trying
what
to
I'd
figure
say.
out. Yeah.
I'm saying this just to be truthful.
Yeah.
Lane County and our local community doesn't control. The governor has to say, the governor said, you cannot open, you can't go into phase 1 until the governor says so.
Of course.
So
yeah.
what we're doing is we're trying to get everything set up.
Yeah.
So that we can get a thumbs up from the governor.
Yeah.
And once we get that thumbs up, then we can say, okay, we can move into phase 1.
Yeah.
And at least businesses then have the ability to say, okay, I can. So I think it's, important from a business community standpoint, folks start thinking about, okay, what would that look like? May 15th at the earliest.
Yeah.
How am I going to start to sort of phase things in? And I don't think that we should expect, if you watch the national polling on these things, consumers are still skeptical. And a lot of people are like, I don't think people are going to be rushing out of their house.
Yeah.
Because so think about phase 1 as a sort of incremental, slow thing that we're going to peek our heads out the door and go, okay, maybe I'm going to go, test some things out. And then as we get, over the course of through May and into June, I think we'll get a sense of how are things feeling, how do the numbers look, and if it looks pretty steady, we're going to have a better comfort level. But so much of this is going to rely on all of us as a community continuing this physical distancing, even when we go out. Keep 6 feet of distance, wear a mask when you're in public. I mean, it's weird. I said to our employees this week, I don't like it. I feel silly. I think people are judging me if I'm wearing a mask. But it's what we have to, regardless of our own feelings about it, if we want to start opening up, it's just, these are the things that we need to participate in order to do it responsibly.
Yeah. So let's, I guess talking about the mask component, and again, I know we don't have the final requirements from the governor's office, but, I have a note here, and there's kind of a couple questions, which we'll get to all of them, but one of them that folks are kind of questioning is what is going to be required of business when it comes to PPE and providing it for their employees, and how do we help businesses get that equipment? We did a survey of our members to see if there was a way for the chamber to try and, procure some of those PPE materials in mass to distribute if they'd be interested. I'm just curious, what's the county's role in that? Someone asked about, they've tried to get PPE, but supplies have been redirected by the government. Every time they've tried to order it, their order's been shipped somewhere else.
Yeah, and let me make a distinction. We say PPE, and then a lot of things get lumped into that.
Right. I guess
So-
I'm referring to masks, but yeah.
Yeah, in masks, here's what's really important. The surgical masks and the N95 masks, which
Yeah.
filter the virus more effectively.
Yeah.
Those masks we are reserving for our first responders, right? So hospital workers, people that are in the hospital, people that are in clinics, people that are doing testing, emergency response folks. Those people are the ones that are most at risk and exposure to the virus directly on a regular basis.
Right.
We need them to have those really robust capabilities. The rest of us, we need to be these homemade masks that people are making, and these face coverings, the cloth face coverings. You can go on the CDC's website, and the Surgeon General in 45 seconds shows you how to make a homemade mask. So it's very easy to do. Those are the types of things. And, depending on, if you're in the food service industry, the need for certain things like gloves and sanitation stations and those types of things, which many food services, they're already capable and set up to do. It's going to look different than maybe a retail operation, right?
Right.
So it depends on what the business is, but face coverings, I think, are going to be an important thing. I would again tell folks that unless you're in the first responder health industry, don't be looking for N95 masks. Just figure out how do you get a supply of face covered masks. Have your employees cloth face masks. Have your employees wear those, then take them home at night. Have a process for washing them so you have them clean for the next day for folks. Have sanitation process, continued good washing of hands, hand sanitizer. Those are when we say PPE for the general population, that's what we need. The best, most effective things for all of us are physical distancing of 6 feet. Keep that 6 feet from people as much as possible. Wear a cloth face covering around others. Wash your hands regularly and use hand sanitizer. Okay, so that's really what we mean by PPE.
Someone asks, who will be evaluating the plans that businesses will be required to develop, and what does that process look like?
So each business is gonna, the governor's put out criteria. We are not, Lane County doesn't have the ability, and I don't think there's any governmental agency that has the ability to review every single business's plan.
Yeah.
This is going to be trusting folks and saying, you know what, and I think businesses know that in order to get customers to come participate, to patron their operations, they're going to need to do these things. And so each business is it's a bit of a trust factor. Develop your own plan that employer policies that have things like how you're going to achieve distancing, how you're going to have the PPE that I mentioned. Are you going to do temperature checks? Are you able to do that or not? For certain things like bars and restaurants, that may be more necessary than for other types of operations. Sanitation, monitoring of employees. So if they have symptoms, you're sending them home, or those kind of things.
Yeah.
So that's what we're doing on that front.
Do you know if there's any businesses that won't be allowed to open in phase one?
I don't have the governor's guidance in front of me here, but it is my understanding that there may be some, if you can't maintain that physical distancing, or achieve some of these critical thresholds, then that may be the case. So I would refer people to the governor's blueprint for opening, which is again, still a draft.
Yeah, Rob, we're anxiously awaiting kind of the final versions of those. So as soon as we have them, we will have it up on the Chamber's website, and we'll make sure to push it out to our membership as well.
Brittany, I want to say, because you asked specifically about people, the cloth face masks and those kind of things. So I'd encourage businesses. A lot of people are making these at home.
Yeah.
Right? Our employees have been making them for other employees. They're just kind of doing it. We do, and here, let me give you an email for any businesses that we have set up that you should send these inquiries to. LC, as in Lane County, LCBUS concerns. So LCBUS CONCERNS at lanecountyor.gov. LCBUS concerns at lanecountyor.gov.
Great.
Any questions about how to access? We're putting together a one-pager that we'll make available on our website about how business resource. And I know that you're working on this, the Eugene Chamber and the Springfield Chamber have been working to try to provide like FAQs for businesses.
Yeah.
Austin Ramirez told me to review that and it looks awesome.
Good.
So we're going to do this too, to say, okay, if you're a business and you're looking for PPE, here's places you can purchase them from. We're trying to find verified vendors that won't gouge you.
Yeah.
They'll charge market rate for appropriate market rate for these things. Here's where you can get, donations or other things for that. So we're going to try to provide those resources to businesses.
That's great. Thank you, Steve. Someone says, Gretchen Doobie from OSLP, where do residential long-term care facilities fall into the governor's 3-phase plan? If we serve a vulnerable population like people with intellectual and developmental disabilities, are we to assume that we are part of phase 3 reopening?
I think that's generally a fair assessment. My read of the draft language from the governor is that nursing homes and long-term care facilities are in phase 3. Those are vulnerable populations. I mean, Lane County does, we have 70 plus staff that do support services for developmental individuals and families with developmental disabilities. All of those folks right now are doing it via phone contact. So we can't do it in person now. And so most of that is going to come in phase 3.
Wonderful. Thank you. So shifting a little bit here, I want to talk more about kind of economic recovery efforts, right? So moving out of response mode and kind of the immediate to longer term. You mentioned Austin Ramirez, who is, your all's economic development director at the county. He's been doing an amazing job, and I really appreciate how hard of a position he's been in too. I'm just curious from your perspective, what does it look like to have a regional economic recovery, and what are you seeing? I guess, okay, that's one question. And then I have another question about rural communities. So we'll go to the big picture one first.
Yeah, economic recovery is going to be, you made the point at the beginning, Lane County we are the public health authority in the community. And so, because we have that expertise and we have a regional role, we have an obligation to be the primary entity doing response to the emergency response to the public health emergency of COVID-19. As we shift into recovery, that's going to be, we're developing plans around this, and I can talk about it, kind of our 3-point plan with providing technical assistance to businesses around adjusting to the new economy, around multi-value infrastructure, such as broadband investments, and then focused financial resources where we can. Those are the 3 areas we're generally targeting for support for businesses. I mentioned the $400,000 small business loan program we put out, and that was a stopgap. I mean, we're not going to be able to continue to just put loan programs out there. We really want to help businesses adjust to this new normal. So that's going to be our approach. But here's the deal. We can't do this alone. We don't have all the expertise. We need the chambers. We need our city partners. We need the University of Oregon. We need other community leaders. And, we need folks like United Way and nonprofit service providers serving vulnerable populations to assist in what recovery looks like. Yeah. Our recovery planning is going to be focused on 2 things primarily. 1, local economic recovery and support for businesses that have been impacted through the things I just mentioned. 2, support for vulnerable communities, because we know that, listen, renters are significantly impacted. Unemployment is probably pushing 20%. Not quite there yet, but we're probably pushing 16, 17% in Lane County right now, based on the initial data that we've seen.
Yeah.
We've had a moratorium on evictions, but at some point the rent is going to come due. We're already dealing with the homeless and housing crisis in Lane County that we got to deal with. So we will also want to make sure in supporting our business community and the local economy that we're also making sure we don't end up with more people that are unhoused in Lane County. So that's our kind of 2 primary focus areas: is local economic recovery and business support, and then support for our vulnerable populations. And again, this needs to be a community lift. So this will not be, all right, folks, this is going to be Lane County saying, here's what we can do. The chamber saying, here's what we can do. The city's saying, here's what we can do. And what I want to appeal to is, let's try to coordinate all that work
That's right.
so that we're not stepping on toes, we're not redoing or, being redundant in our efforts, that we're all really saying, let's do what each of us does well, and ask for support in the areas that we don't have capacity.
Yeah, I think that, my biggest ask in this whole recovery conversation is that business leaders are brought to that table too. I think that, obviously the expertise from the state, from the county, from the city, and our chamber staff. But to me, it's all for naught if the business leaders aren't at the table saying, here's what we actually need, right? I want to respond to their needs and they're the ones boots on the ground. So we can put together the best laid plans, but if they're not really driven around what they're actually seeing, then I think we kind of had a miss there. So I want to do whatever we can to bring those business people to the table. And I know you're super supportive of that too. So I think that that's a huge component of this. And I know our members are super anxious to be a part of that conversation. On the note of recovery and really kind of response, I'm curious what the rural communities are looking like. I've heard in a lot of these Zoom meetings that we're all sitting on all day, every day, that the reaction and the response from our rural communities across the county have been really diverse, right? We have coastal communities, we have communities, to the east that haven't really been impacted. And so they want to see reopening quicker maybe than others. And our county, you always talk about, is about the size of Connecticut. And so how the heck do we manage all of the diverse needs of those different rural communities as well?
Yeah. You asked, and let me answer as part of this question. Earlier, you asked about the confusion about, well, are we doing regions or states are opening? I just want to put the nail in that coffin. We're going to open as a county. Right. Okay. We're not doing parts of the county. We're not doing it's like we're going as Lane County, and we're going to ask the governor to open as soon as possible. And then the whole county is going to go. And we're going to have to rely on our local communities, the cities, the chambers, the businesses within each of our 12 cities and unincorporated areas to do what's right for their own individual communities with the county's support and participation and guidance. In terms of rural communities, you're right. I mean, that's been, we've really had a push from a lot of our rural communities to say, hey, listen, we haven't had positive cases. Most of the vast majority of the cases have been in the Eugene Springfield metro area. So can we open? Yeah. And so that's one of the reasons that we're saying, yeah, we need to really push to open here, and businesses can open on their own timeline. Just because if we go on May 15th, doesn't mean that everyone you do it on the timeline that works for you, but we want to give you that ability to do it. I think you're right. The businesses on the coast, it's been a mixed bag because they are tourism, supported by tourism, but we've also been told people, don't flood the coast right now. Don't everyone go to the coast because you want to get out of town, because you're going to overwhelm that community. They won't have the ability to. So I think we want to think about these things. There are, in the governor's phasing, there are some restrictions in the earlier phases around, in phase 1, non-essential travel is restricted, right? The question becomes enforcement about this stuff. How are we going to enforce that? I mean, it's going to be difficult to enforce all that, but at least the state is saying, we're going to sort of restrict. If you don't have to be traveling outside of your community, we're asking you not to do that. Yeah. But we want to get things open so that, I mean, I heard this from one of our commissioners today, a small hair salon that has one person working there in a rural part of, the community in Veneta. Why can they not open? And they have one person, and if they're wearing masks, I mean, is that something that we can accommodate? So these really small businesses that have just been shut down, we want to try to allow as much flexibility as possible. It's part of the reason that the board and the county have asked for more local flexibility from the state to say, listen, Governor, give us a little bit of flexibility to work with our business community responsibly to say, maybe a hair salon, you say that shouldn't go in phase 1, but if it's only one person and we can do it by meeting these other criteria that have been laid out, is that a reasonable thing for us to be able to do?
Yeah, that's a really good point. I got another question here from Facebook. So in the draft kind of reopening guidelines that was sent out last week, kind of industry by industry specific, one of the components that was in almost all of them, if not all of them, was this requirement for businesses. And again, this is draft, so I'll preface that. A requirement for businesses to keep track of who their customers are and who's been in and out of their buildings. I did get quite a bit of concern from businesses whenever we were pushing those around, folks saying, look, like, my customers might not want to do that, right? There's definitely folks who are hesitant to give their contact information out for those purposes. And then there were some people saying, but I've been going to the grocery store for 2 months, not having to do that. So why, as a small local retailer, do I have to ask my customers? And so I'm just curious. I don't know if that will continue in the final plans for the governor's reopening, but I'm just curious, what can we do to help educate the public so the businesses don't feel like they have to bear the burden of making folks uncomfortable?
Yeah, we can check on that, and I don't know if that is in the latest draft version or if it will make it into the final draft version. I think the rationale behind that requirement is the contact tracing piece. Right.
Yeah.
If you the public health officials need the ability, and that's how this is going to be successful. Ideally, what happens until we get a vaccine, I mean, that's the ultimate solution here, right? We get a vaccine and treatments that are effective at treating this. And then we're going to all feel more comfortable going, okay, we can get back to some version of normal because we actually can prevent this thing or treat it when it happens. Until then, opening up requires us to do testing, do these preventative measures, do testing, and then be able to quickly, if someone tests positive, go, where have you been? Who have you been in contact? And isolate that group of people so we don't have to shut down the entire local economy or nation, right? That's why we had to shut the whole country down, is because we didn't know where the virus was. Right now, we feel confident, like, okay, we slowed the spread, flattened the curve, kept it contained, we can incrementally open up. But in order to do that, we have to have the ability to know where the virus is going. And so that's what that contact is about. I totally understand. The reality is right now, people are going to the grocery store, but it's easier to trace where things are happening because we know grocery stores are one of the only things that are open.
There's fewer things open.
You were at this grocery store and you can trace all that. Now when things start opening, it's harder to do that. So the reality of doing that and customers being willing to provide all that information, I think there is a reality of the challenge there. But my view would be we need to try to do, and we would want to encourage businesses, even if it's not a requirement. Try to do it. Try to have an idea of who's where your employees are and your customers. If you can do it in a way that doesn't turn off your customers, doesn't make people feel like they're vulnerable to some kind of other privacy related issues.
One thing that I think I lifted this to Austin last week that could be a valuable resource that the county would provide is just a template for that tracing, right? Give us a spreadsheet with exactly what customers or what businesses should be asking, and then have it be one consistent form that every business who's willing to uses. And that way, I think as a customer, I would at least get used to seeing that exact same thing. And I would know this is not the business trying to get my personal information. This is obviously some, kind of formal process. So that's just one recommendation that I would put out there.
I think that's a great suggestion. Those are the kind of things
with the county on it. And
like here's the form. And I mean, as businesses, I think that's the challenge businesses are in is no one's been through this before.
Right.
Businesses are public health officials. So you need to rely on the public health officials to help give you guidance and information about how to do these things. I really encourage you're doing that, Brittany, connecting with Austin. If individual businesses have questions, they should either be going to you to ask those questions or send to lcbusconcerns@lanecountyor.gov. Send those questions. We'll respond, and then we'll put those things on our kind of FAQ guidance for businesses.
So we have just a couple minutes left, and I did want to touch a little bit on the impact to the county. So the county as an organization, what are some of the impacts that you've seen, financial, otherwise? And I know there was an announcement yesterday that the Board of Commissioners decided to postpone going back to the public for the courthouse levy. So I'm just curious, my specific question on that was, are we at risk of losing the state funding by not doing that? But
we took on the courthouse one. It was not an easy decision. I mean, I've been here for 6 years. I've spent the better part of 6 years with a lot of other folks working on this. We know the need hasn't gone away. The need is greater today than it was before. Think about bringing jury pools in. You get called for, I mean, the physical distance and all that stuff is.
I've toured the current courthouse. It is not adequate.
The safety, security, accessibility, space issues are all there, and they're getting worse. But here's the thing, we all know, like, we can't ask our community to fund this big project at a time that businesses and residents are reeling from an economic shutdown like this. People are unemployed, their wages have gone down, businesses are hurting. So the time is not right, and we would be foolish to move forward with that effort now. So we're going to work with the legislature and see what we can do on that $90 million they set aside. We just knew that we were not in a position to reasonably ask our taxpayers to support that project, given everything else happening. I
appreciate that. I think it's really good.
Yeah, the planning will continue. The advocacy will continue. We'll come back at some point. People need to know that the problem isn't going away, but it's a timing issue right now. On the other areas, we launched our budget with the budget committee yesterday. Our budget for the fourth year in a row is structurally balanced. We have no layoffs, no cuts in services, no use of reserves, all good. It doesn't mean we don't have concerns and problems. The areas we're particularly concerned about are things like that are funded by transient room taxes, video lottery taxes, car rental fees, use fees, things like parks and Lane Event Center. We haven't had any events at our Lane Event Center and fairgrounds. We haven't had anyone camping in our parks. We're also concerned, so parks and Lane Event Center areas we're really concerned about. I know the city of Eugene is concerned about parks and recreation as well in the city. We're also concerned about things like that are funded by the state of Oregon, because the state is heavily reliant on income taxes, and as unemployment has gone up and wages have gone down, people are paying less in income taxes. So, public safety services, things like parole and probation, our mental health services for the community, we're concerned about. So here's my thing. We spent 6 years structurally balancing our budget, building up our reserves, planning for exactly this moment. We didn't know COVID was coming, but we knew there was something that was going to hit. And we didn't want, in an economic downturn, to have to start laying everyone off and cutting services. So, we have reserves in place where we believe we'll be able to stabilize through this temporary downturn. The question is how long. I can't tell you 6, 9, 12 months out looks really murky. I know weeks out looks murky for business. For us, months out looks murky. In the short term, we'll be able to manage. The question is, what does the longer term horizon look like? And I want to avoid layoffs for public employees because our employees provide public services. So anytime we're laying off public employees, it's a cut to public services. Right. And it's more people unemployed in the community that aren't out there spending money and participating in the local economy. So that's the rationale there, is to maintain continuity of service as much as possible. And it's going to be a lift to figure out how we manage that in the long term. We are investing in some new things in our budget next year, particularly supports for the business community, and I can talk about more of that later, around these things like technical assistance, focused financial resources, partnerships that will help. And then we're investing in our portion of the funding of opening up a new shelter and navigation center. Lane County purchased the VA clinic on 100 River Avenue. We're using it for COVID response now. Our plan is to convert it into a low barrier public shelter navigation center for unhoused people, and people will go in there through a triage process, and they won't leave there until they get connected to permanent housing. We're also we provided resources that will help with renter supports and rapid resolution. So working with people before they fall into homelessness to get them reconnected to housing when they're in a vulnerable. And we know people need that now more than ever, as folks are at risk, renters are at risk of falling out of that. So, and some people may say, well, how can you justify putting more money into something at a time like this? And my answer is, how can we not? Like, now is the time we need to be supporting our local economy and local businesses and our most vulnerable in the community. So that's our plan. And Lane County has seen a lot of cuts in the past and instability in the past, and we've spent 6 years creating this stability so that we can be resilient and help lead our community through this really tough time. So that's where we're at for now.
I've been incredibly impressed, Steve, by your leadership. And I know that there's other folks in the business community who would agree with me that, you've done a lot of work to right size the county and to start to work better within your means. And you've been really honest, I think, with the public when it comes to, here's the funds that we said we were going to bring in. Here's what we said we'd pay for. I mean, you guys offered refunds and, didn't raise taxes to the amount that you could have because you knew you had what you needed to get done what you needed to do. So I think it's going to pay off. I think that you've really built up the trust across the community, and I can appreciate the 6 to 9 months out. I'm the chamber running our organization. We're unfortunately in the same boat as a lot of these businesses where we're looking at months, and a lot of our revenue is really tied to how well the economy and businesses are doing. So, I think that we've got a long road ahead of us, but I appreciate your leadership. I appreciate, just your perspective on this and how well prepared I think you've made the county to deal with this issue. We're excited to be a partner in that, continuing to move on in that way. And I feel like I could bring you back tomorrow and we could go into a whole nother hour worth of conversation. So hopefully we can circle back around in a few weeks. I'd love to get more into the conversation about homelessness and some of the services the county's providing in that way. I think you're right. I think making investments at this time feels kind of risky, but if we're talking about an economic downturn and folks losing jobs, our homeless population has the risk of going up. And so to back away from that right now, I think it'd be a really hard decision to make. So, anyways, I appreciate your time. I know you have a lot going on and it's been wonderful. This is one of our higher attended events. And I know folks are, they've been anxiously awaiting to kind of see and hear how the county's been doing. So thank you for providing this.
Yeah, I'm sorry I can't see everyone, but I know you're out there listening and we're thinking about you. And thanks for all the work you're doing, Brittany, and the businesses out there. We're pulling for you. Let us know what the county can do to help support you. We're there. And we're going to do everything we can to make sure that our economy gets back up and roaring again. So keep us posted. Happy to come back anytime. Let's look forward to May 15th and I'll get this community back open and running again.
Absolutely. Thank you so much, Steve. Thanks, everybody.
Thanks.
Have a great afternoon. See ya.